So yes, good afternoon, everyone. I am Dr. Immanuel Azaad from the Mohammed bin Rashid School of Government. I'm an associate professor of health policy and administration, and the program coordinator for the Masters of Public Policy. It gives me great pleasure tonight uh, in presenting our fourth session on hashtag Beyond COVID-19. Tonight's session, we will be talking about health policies during and after epidemics. Now, we will try to make this as an interactive session, as the most interactive session as possible, whereby we'll be seeking some responses from yourselves. I'll be asking a couple of questions where you would respond yes or no. For instance, if I say, okay, are you a boy? No, you can put no or yes, and so on. Okay, so for the context of today's topic, we would like to talk about the health policies during and after epidemics. Just as an overview, a quick overview of what we'll be doing, the structure. We will define what is health policy, the context in the UAE. We will try to differentiate the difference between epidemics or if there's a difference, so to speak, and then focus on the three phases that are needed when managing epidemics, where it comes to the responsiveness, your preparedness, firstly, your responsiveness, and then thirdly, your recovery period. Now, without further ado, I would like to ask you, do you think health policy affects everyone? Do you know what is health policy? In the meantime, what you can do is you can also feel free to state, the country that you are sitting in right now. We know that we have viewers from all over the world that are plugging into tonight's session. So you can also, I can make some examples as well. Now, health policy refers to those decisions and plans and those actions in order for stabilizing the health of a particular country and at a national level. Now, we need to differentiate and know that there are two distinct types of health policy. The first element focuses on your healthcare policy, which is really the healthcare infrastructures that are put into place, your financial needs, your resources, your capacity in terms of your man labor, your human capital, and also in terms of your bed space, as well as your overall introduction and your quality excellence issues as well. On the other hand, we also have policy for health, which actually addresses us as the public in an overall, where this is focused on those types of healthcare services that are delivered also, and you can see from the time we were born all the way to when our grandparents have to depart from this world, they are involved in some stage in their lives in some sort of interaction with healthcare services. For instance, when you were born, mothers and children healthcare services would have been provided accordingly. We also, when it comes to policy for health as a whole, it's important to understand that within this domain, we tend to look at public health and the advocacy. And when it comes to health education and awareness, in addition to those preventative measures in order to promote the improvement of the overall health status for a country. Now, we may ask, what triggers health policies? We are living and breathing it at the moment, whereby COVID-19 has really taken over the world. As kids, when we would look at a cartoon on the weekends, you always have that superhero that takes over and helps in the times of crisis. In the same instance, COVID-19 has actually taken over. Not in this case, it's not a hero, but it's a distractor. Now, there are many factors that triggers it. So given that it's a pandemic, has been classified, which we'll talk about in a bit, We also have other factors, which would be your leadership priorities that helps determine the shaping of health policies as a whole. Now, there is also the public concerns that helps to bring policies into play when we talk about improving healthcare, as well as the strategic decisions and directions. Now, we'll just take a little step back in terms of the global health, the global goals. Some of us may know of the SDGs, the Sustainable Development Goals mandated by the UN itself, which is a 15-year strategic plan, and there's a series of 17 goals that helps that provide some sort of agenda for the country in operating. And there is one specific one, goal number 3, which is dedicated to improving the overall health and well-being for that person. Now, we taking this at the global level, let's take the case of the UAE, for instance. This has been cascaded at the federal level and then went down to the various emirate levels, where clear strategies and directions has been put into place. So these are some of those triggers that contribute to the shaping of health policies as a whole. Now, my first question for the audience is, do you think there is a difference between the word epidemic and pandemics? In the meantime, while you are answering yes or putting 1, typing in 1, or typing in no or 2, you can feel free to. In the meantime, while you're doing that, I will just take you back about a month and a half ago, where the World Health Organization categorized the new coronavirus as a pandemic on March 11th. Now, this prior to that, it was classified and been termed as an epidemic / outbreak as a whole, and we're seeing a number of yeses, some no's. Yes, yeah, most of it is yes, which is excellent. Good. So, yes, the answer is yes. You're correct. You can give a pat on your shoulder for answering this one right. Now, there are 2 distinct differences that we would need to focus on here, where when it comes to epidemic as a whole, it is that event where the disease is actively spreading, which we've seen and witnessed in the case of Wuhan in its early era, in late December into January. And then within an epidemic, it describes the problem that has grown out of control, and it is sometimes known as an outbreak. Now, for it to move across to being classified as a pandemic, this really relates to the geographic spread of the outbreak itself / an epidemic, and it affects the entire country and the world at large. As we know from the latest statistics from the World Health Organization, over 220 countries and territories across the world is being affected by the COVID-19. Now, we also would need to identify, when it comes to health policy as a whole, the word epidemic itself typically is being used to describe matters when it comes to the health nature itself. So hence the inclusion of epidemic in our title tonight. Now, to get to the crux of the matter at hand, health policies are tremendously important when it comes to managing epidemics. As highlighted in the outline, we will talk about 3 main classifications. You have your preparedness phase, you have your response phase, and you have your recovery phase. Now, my second question to you all is, do you think your respective country was prepared prior to COVID-19? This is in the preparedness phase. While you're deliberating and typing in your responses, I will just talk about what we mean by preparedness as a whole. So preparedness is those tools and policies and regulations that are set in place prior to any sort of outbreaks any sort of disasters, regardless if it's natural, infectious diseases, and so on. Now, and we're seeing a lot of yeses there. Now let's classify. Let's talk about those factors that makes a country prepared when it comes to the preparedness aspect. Now, one of the main factors, and we can see the UAE, for instance, the National Health Crisis Emergency Management Authority is tasked with the main mandate in preparing a plan, a crisis management plan and disaster management plan in place. Countries such as Trinidad and Tobago, where I come from, they have an office dedicated to crisis and disaster preparedness as well. In France, similarly, in Germany, countries across the world has some sort of dedicated unit in having this in place. So this is one of those main factors where in terms of preparedness and preparing a country, having an organized disaster management team or unit or department in place within a ministry particularly, this can be helpful. In addition, having those key priorities in place and making a forecast of those health impact projections. In the case of the UAE, Dubai is the hosting city, has been selected as the hosting city for Expo 2020, which has been scheduled for later this year to launch in October. However, there are discussions for a possible postponement onto next year. Now, having said that, there was a special committee that was put together in planning for dealing with disaster and crisis management and some sort of infectious disease outbreak, where there was this special committee was formed and tasked by the Ministry of Health and Prevention of the UAE in coordination with the other health authorities within the the United Arab Emirates as a whole. In coordination with your private sector, your NGOs, and so on. So there has been this plan that was put in place. Now, within these sort of plans, there would be a couple of assessment of resources in terms of your human capital, what sort of risks that to project and forecast, how to prioritize the care in case if there's some sort of infectious diseases and to reduce the deaths, as well as to continue the training for those community health providers and those first responders. And in addition to having the manpower in terms of your physician to patient ratio, in addition to ensuring that you have your bed capacity, enough spaces within the hospital as a whole. So these are the three main factors that really contribute to ensuring that the country is well prepared. Now, on to the second phase where we can look at is your response, the response aspect. Now, my third question to you would be, do you think your respective country has been effectively responding and having mechanisms in place during the COVID-19 period at the moment? While you're deliberating and writing your answers, I'll just take you through as to those factors during the response phase itself. Now, there are a couple of introductions. Going back to the committees, having those committees, those units that are tasked with the mandate for running and planning for disasters and managing the crisis as a whole, having that information up to date all the time and having those key messages that are coming across in terms of putting the proper messaging and positioning it in such a way. For instance, in the UAE, Dr. Farida Al Husseini is our key official spokesperson, in that she will every day between 4 and 5 p.m. will make some sort of official announcement with regards to the latest updates when it comes to the COVID situation at the moment. Also, we have the Supreme Committee on Crisis and Disaster Management, which has been taking a major role on this task as well. During the crisis, during the epidemic itself that we are currently facing, there are a lot of rollout plans that are happening, where we can see, for instance, the voluntary coordination that is happening. We can see the rapid responses from our healthcare services that are happening. Also, in addition to having those public sanitation drives, we came across the obsessive need for washing the hands and not touching the face, and so on. So also to wear masks and gloves and the guidance in these sort of different sanitation policies. We can also see the rollout of the telehealth and the telemedicine that has come into play, where, for instance, in the UAE, there is the Every Doctor, Every Citizen initiative, 24/7 initiative, where it allows for citizens to consult with the doctors virtually in those cases where it is non-critical. So this has allowed for telehealth and those services to emerge and have those teleconsultations to take place. In addition to other rollout plans in terms of, and the famous one where all of us are locked down, working from home, having our kids being homeschooled and doing their education distance. These are some of those policies that are to ensure the safetiness and limit the spread, which is another factor, limit and contain the spread of the COVID-19 itself. So as to ensure that we have closed the borders, for instance, a couple of weeks ago. We've also have those drive-through COVID detection centers that has been put into place. We also have the drones and the military and police surveillance that has been happening. And also we've been advised to self-quarantine if you had come out from traveling, which had taken place with me from a personal experience late February into early March, where myself had to be self-contained for 2 weeks, 14 days before getting back into the public. And then there was the national lockdown in terms of the national lockdown as well as working from home and decrees that came into play, all in the effort of limiting the spread and the containment of COVID-19. Now, it's also within the response aspect from the government's point of view, it is very critical to prevent panic and chaos within the country, to maintain stability, in that ensuring that there is continuity in terms of economic businesses, the running of businesses, the substitution of loans or delays of loans, rents, bills, and so on. We have many examples of these. Here in the UAE, we have billions of dollars of dirhams that has actually been injected into the economy to help both the public and the private sector. Now, these are some of those policies that were put into place to help mitigate preventing a panic across the country, as well as positioning those key messages as a whole in order to give the right amount of information and the sufficient amount of information so as to prevent that panic from taking place. Another area that which has been a talk of the town across the world is the excessive buying. The UAE has been very successful in ensuring that food security within the country, and especially for those persons and identifying those key persons that would have been mostly at risk in terms of food insecurity. The UAE, alhamdulillah, has been very good in keeping this food security for us within the country itself, and has also lent its hand to many other countries within the region and across the world. Also within the food and nutritional aspect, it's important to also highlight that mental health and well-being policies were put into place. For instance, there were many mobile apps that have been developed by the various health authorities across the UAE to help those that were having a hard time and even getting a bit depressed about the current situation in terms of the COVID. These apps and these call centers were put into place to help give stability to these persons that has been having a hard time. And then another important point is in terms of the triage of the response itself, making sure and having systems in place for prioritizing and reducing the deaths and being able to focus the resources to those mild and severe cases and training those healthcare responders, so to speak. The third phase, which really focuses on the recovery aspect. My fourth question to you will be: do you think your country has recovery plans in place and health policies in place to deal with the post COVID-19 period? Now, while you are deliberating and writing your answers, I will explain in terms of the recovery aspect. When we talk about the recovery aspect, it's thinking about those tools and mechanisms and policies and regulations that are needed to put in place when it comes to restoring life and resuming life back to normal and to reintroduce back into the economy as a whole. Now, I'm seeing a couple of yeses that has been running, which is indeed critical for the post period itself. Now, it's very important for us to consider those policies that are needed. For instance, we are all locked into our home, working at home. So there would need to be specific policies in place to reintroduce the populations, for instance, in terms of returning back to work, as well as returning to school. There are some countries that has already been responding and going back to their various workplaces and going back to the schools as well. But for the case of the UAE, it's in a work in progress, and plans are being put in place in order to deal with the post COVID-19 period. It is also critical for us to understand that we learn from all the policies at the preparedness planning phase, as well as those policies at the during phase, when in the response phase, and learning from those policies, what went well, what didn't go well, how can we improve for the next rounds, now that we are hoping that we are hit with another pandemic in the near future. But being in a position so as to document those lessons that are to be learned, as well as doing that comparative policies analysis as a whole. Now, it's important for us to understand as well that the news media communication is very critical post as well. So there will be a mix of messages that will be going out. Again, it goes back to the designated authority and crisis management authority as a whole that would be tasked in terms of delivering this news feed as in going back post COVID period. And at the same time, it is also important for us to really look at those innovations and those technologies that are needed to continue with it. For instance, telehealth. Does telehealth stop during afterward? It would be a great idea to continue with it and to push this forward as well, so as to lessen the burden on the healthcare system as a whole. It is very critical for us to note that health policies as a whole is very forward-looking, and it's really government foresight that needs to take place here. Also, it involves thinking outside of the box. So that black box of policy making, it allows for us to really outward look into what sort of policies that we need to take into consideration. Going back to the crisis management uh, planning in terms of dealing with infectious diseases during the expo itself, this in the case of the UAE has been preempted, and we would say we are very blessed that we had those extra plans in place to manage the epidemic. As we can see, the UAE has been classified as in the top 20 in the world for managing the COVID and being safe around it, as well as UAE has been in the top 10 in the world for the efficiency of the treatment in terms of tracing, in terms of testing, and so on. So it is a combination of many policies and actions that has put into place with regards to the success, and it is an ongoing process. Health policies don't stop at all. It is continuous. It must be a continuity of creativity and innovation, and it must also involve many sectors. As we have seen, not only the public sector has been involved, also you have the different ministries that has been involved, the private sectors has gotten involved, the non-government organizations has also been involved in ensuring stability and best managing the epidemic as a whole. Now, in addition, it's also critical for us to really look at those measurable health impacts as a whole, and focusing on using evidence-based policy options to inform our decision making for the near future as well. So it is very critical for us to keep this in mind at all levels when talking about having good health policies, and for it to be as successful and most effective and efficient accordingly. And in terms of the health policy itself, it is critical to put systems in place in order to monitor, evaluate, and formally review these policies so as to continuously improve systems, processes, procedures as a whole. It is very critical for a country, as we have heard from Dr. Ali in his first speech, his first talk in this hashtag Beyond COVID-19 session, where he's talked about the resilience of the government, in addition to Professor Meledina talking about agile government. And they've both highlighted the importance of the government to be agile and adaptable in times of crisis. And we also heard from Dr. Abdullah, who spoke about in dealing with the economy, how the economy would deal in this post COVID-19. So ensuring that these and many other factors that are critical for ensuring that the health policies are best managed with all these different sectors. We are all in this together. It is not a silo operation. I am proud to be part and parcel of the fabric and the foundations of the UAE and living in the country. There are many countries across the world that has been successfully containing the disease, the COVID-19 virus as a whole, and we must give thanks and appreciation to all the first healthcare responders, the nurses, the doctors, every single person that has been involved in the front line on this bit. For health policies to be successful, it is a unison. Everyone needs to come together, as we have seen worldwide. There's been a unison in terms of many countries and sectors that are coming together. Alhamdulillah, it is a good practice, and it shows that there is agility in terms of managing and thinking outside of that black box, as so to speak. Without further ado, if we can more or less, I can take a couple of questions, as I've been seeing a couple of questions. Earlier on, I saw in terms of mental health, yes, there are mental health procedures and processes that has been put into place for for citizens that are having a very difficult time during the COVID period, just to deal with the depression and so on. So yes, there are those policies in place for it. And special kudos and thanks to the UAE government, the rulers and the leaders of the country, for all the directors, the director generals that has been making sure that the country are sustaining the overall health status of the country. Taking into account that COVID-19 is not the only disease that is facing us in the hospitals. We still have pregnant women that are coming into the hospitals. We still have heart cases, heart attacks. We still have accidents. There's still traffics. We still have many other health conditions that are happening, and at the same time, it is great kudos to the government and the leadership in ensuring that these practices that are playing a part. Also to add, where we work at the World Trade Center in the vicinity, the Dubai World Trade Center has been converted into a field hospital where there are over 3,000 beds that were put in to help manage the epidemic as a whole. Now, it is important for us to consider and understand that these were all preparedness plans that were put in place ahead of time, and it was just a matter of executing. I can take a couple of questions. I'm scrolling through. I'm seeing a couple of questions. Believe we've answered most of them. Let me just check some questions. So in terms of the national mental health program, yes, there is a mental health decree that has been that is around and alive. So there is the national health program in place here in the UAE. On the other hand, in terms of the health insurance covering for mental health, indeed it is indeed considered a taboo subject. However, in the context of the UAE, His Highness Sheikh Mohammed has great love and appreciation for the people of determination, and has many services, and has urged governments and all government entities to be very inclusive in terms of integrating people of determination as a whole. In terms of artificial intelligence and health, robotics has definitely been it is a key role that is around, and it is a booming industry here in the UAE as well. And there are policies in place that are coming to light with respect to merging artificial intelligence in the healthcare sector as a whole, where we can see this is definitely the way forward when coming to. And with we know the UAE has been really working towards into reducing the prevalence of non-communicable diseases. Yes, indeed, it is within the mandate of the UAE to reduce these numbers, which has been dropping, at least in the last 6 years. From the statistics that we have seen, the prevalence has been dropping in terms of the NCDs as a whole. Without further ado, I'd like to thank you all. The Mohammed bin Rashid School of Government, one of our research fields is health policy, where we are currently putting some reports together. Stay tuned to the latest launches of these reports through our social media platforms. Feel free to drop us additional questions. We'll be happy to have these questions answered at a later time as well. And for the in terms of Indeed. So quarantine, from we are currently doing a project on looking at the effectiveness of the lockdown and the quarantine as a whole, and to see whether or not there are effects on this. The results are yet to be are yet to be published. However, just to share some light on this, it is an effective way of preventing the spread of the disease of the virus as a whole, limiting the spread as well. Um, for instance, one of the questions that I've been seeing circulating around in the social media, particularly platforms, is the move permits. Now, the move permits, many persons were asking why. Why do we need a move permit to move every time we need to get out of the home to go to get our essentials, for instance? Now, we it is in the event, the unfortunate event, if you are tested positive for COVID-19, the government then they would have a track record of all of your movements where they can go and effectively trace and see all the persons that you have been in touch with or in the vicinity, and they can track that so as to understand how you may have contracted the COVID virus as a whole, as well as to test others to ensure that they are not they won't be affected as well. So these are some of those policies that are put into place for us to ensure the safetyness of ourselves as citizens within the country. I know it is very it can be very mind-boggling for us, some of us. I know it can be a bit depressing as well. However, hang in there. We are all in this together. We need to keep the faith. Patience is a virtue, and we will come out of this as warriors and survivors. And on that note, I'd like to thank each and every one of you for participating in today's discussion and talk. And we look forward to having you on our platforms in the near future. All the best. Stay safe. Ma salama.